Hi, today we are going to discuss about the lymphatic drainage of the breast. So first year first paper one of the most commonly asked essays is mammary gland. That's why weightage topic is lymphatic drainage. Separate shorter side, so we'll be discussing that topic today. So as we all know, lymphatic drainage of the breast, we are studying the lymphatic drainage of the breast. So the lymphatic drainage of the breast is divided into two groups. There is a superficial lymphatics and there is a deep lymphatics. But two type of lymphatics are superficial lymphatics and deep lymphatics. What do you mean by superficial lymphatics? The superficial lymphatics means superficially skin in the lymphatics. We does not include the nipple and areola. So superficial lymphatics means the lymphatics of the skin except the nipple and the areola. And in deep lymphatics, we can see it is mainly the lymphatics of the parenchyma along with the lymphatics from the nipple and areola. So nipple and areola are deep breast tissue, parenchyma and lymphatics are deep lymphatics or deep group of lymphatics we discuss. And other lymphatics are you should be mentioning something about the axillary lymph nodes. One of the major lymph nodes draining the lymphatics from the breast is axillary group of lymph node. We already know that axillary, according to the location, we can see several groups of lymph nodes are present. Mainly there are 5 groups of lymph nodes are there. And according to their location, there are anterior or the pectoral nodes. And further we can see the posterior group of lymph nodes or the subscapular nodes. And centrally placed is a central group of lymph nodes. Laterally along the humerus, I can see the lateral or the humeral lymph nodes. And just below the clavicle, I can spot one lymph node. They are called the apical, and sometimes I mentioned as the infraclavicular group. So, motha 5 group of lymph nodes axillary കാണാം. Anterior group, posterior group, lateral group, central group, and the apical group. So, just mention something about the axillary lymph nodes. And apart from the axillary lymph nodes, we can see there are some other lymph nodes also draining the lymphatics from the breast. So, they include. There is a lymph node called internal mammary nodes, otherwise called parasternal nodes. So we can see the sternum here. On either side of the sternum, we can see the parasternal lymph nodes. They are accompanying the internal mammary or the internal thoracic artery. So they are called by the name internal mammary or the internal thoracic nodes. And just above the clavicle, we can spot the supraclavicular nodes. Supraclavicular nodes. So here there is infraclavicular and the other axillary groups. And further, we have to mention one more lymph node. There are certain lymph nodes called posterior intercostal nodes. So they are present in between the two costa or the two ribs. So they are called intercostal nodes. They are mainly draining the breast from the posterior aspect or the deep aspect of the breast. So that are the posterior intercostal lymph nodes. And lymphatic drainage there is a diaphragm here. Below the diaphragm, the lymphatic plexus or the lymphatic vessel will form a plexus called subperitoneal or the subdiaphragmatic plexus. And you should be knowing there is a liver here, and close to the liver there are hepatic nodes are present, and there are some lymphatics of the ovaries also important for the discussion of lymphatic drainage. ഇനിയാണ് നമ്മൾ മെയിൻ ആയിട്ട് നമ്മുടെ ഡീപ് ലിംഫാറ്റിക്സിനെ കുറിച്ച് ഡീറ്റെയിൽ ആയിട്ട് സംസാരിക്കാൻ പോകുന്നത്. As we already mentioned, the deep lymphatics means we are including the parenchyma along with the nipple and areola. So before describing the deep lymphatics, first you have to describe a term called subareolar plexus of Sappi, the Sappi's plexus. We know the lymphatics deep to the areola is joining together to form a plexus, and this plexus is called subareolar plexus of Sappi. From the subareolar plexus of Sappi, the lymphatics are collected and drains into the anterior axillary lymph nodes. So ആദ്യം നമ്മൾ ഈ ചിത്രം വരച്ചു വെച്ചിട്ട് എന്ത് ഡിസ്ക്രൈബ് ചെയ്യുക? Subareolar plexus of Sappi describe here. It means a group of lymph vessels deep to the areola, and from the subareolar plexus of Sappi, engoda drain cheyna, it is draining towards the anterior axillary lymph nodes. After that, this is a detailed figure aanu describing the deep lymphatics. We already mentioned about the subareolar plexus of Sappi. Engoda drain cheyna towards the anterior axillary lymph nodes. Along with them, from the lateral aspect of the breast, from the breast parenchyma, they will be joined with the subareolar plexus lymphatics and draining it towards the anterior group. So breast in the lateral bhagathula lymphatics mainly engodana drain cheyna anterior, and some lymphatics also draining into the posterior group also. And after that, they will be reaching the apical group via the central group. So lymphatics from the subaerial plexus of Sapi along with the lymphatics from the parenchyma on the lateral aspect will drain into the axillary lymph nodes, mainly the anterior axillary lymph nodes. They further reaches the apical lymph nodes. Okay, and about 70 to 75% of the lymphatics is draining into the axillary lymph nodes. After that, we mentioned about the parasternal group, otherwise called the internal mammary group. Here it's a sternum is here. So close to the sternum, we can see the parasternal group. So we can see the lymphatics from this region, from the medial aspect of the breast, mainly drains into these parasternal lymph nodes. So from the parenchyma on the medial aspect, it is draining into the parasternal or the internal mammary group. It constitutes about 20% of the deep lymphatics. And we already mentioned about the posterior intercostal nodes. And in dotted lines, we are drawing one lymphatics to this region. Why it is drawn in dotted lines? Because it is mainly draining from the, not from the superficial aspect or the superior aspect, it is from the posterior aspect of the breast. From the deep aspect of the breast, lymphatics towards the posterior intercostal nodes, and it constitutes about 5%. So deep lymphatics, the majority is going into the anterior or the axillary lymph nodes, 70%, 20% from the medial aspect going into the parasternal or the internal mammary, remaining 5% or some few is going into the, from the posterior aspect is going into the intercostal nodes. Coming to the superficial or the most problematic one, the superficial lymphatics. The superficial lymphatics means the lymphatic drainage of the skin, and we are excluding the nipple and areola because they are kept along with the deep lymphatics. So you consider this figure. This is a diagram showing the superficial lymphatics or the lymphatics of the skin. So we are dividing some breast into some regions here. So we take a portion here on the apical portion here. From this region, we can see the lymphatics from the skin is draining directly into the supraclavicular and the infraclavicular group. So breast in the apex part area, direct lymphatics and clavicle meleotum, clavicle thaayulla, supraclavicular and infraclavicular group. These are superficial lymphatics. Further, you divide the breast into two halves. Here there is a lateral half. This one is the medial half. From the lateral half, we can see the anterior axillary groups or the axillary lymph nodes. So they are draining into the axillary lymph nodes. So from the lateral half of the breast, the superficial lymphatics or the skin lymphatics are draining into the axillary nodes. Now we come to the most complex one. This is the we are dividing the medial half into two quadrants, an upper half and lower half. From these regions, we can see nearby there is internal mammary or the parasternal nodes. So superficial lymphatics are also draining into the parasternal nodes. The difference is that we can see some of the lymph nodes, some of the lymphatics are crossing the midline and reaching the parasternal nodes or the internal mammary on the opposite side. So in the some lymphatics from the medial part of this breast, mainly the superficial lymphatics, they drains into the parasternal nodes. Midline cross opposite side parasternal or internal mammary nodes communicate. If some pathologies like Carcinoma Breast present here, can metastasis into the opposite breast, opposite side breast cancer chance, and this spread is by the parasternal lymph nodes. There is one more problem here. Here is a lower medial quadrant. From this quadrant, some of the lymphatics will crosses the diaphragm and reaches the subperitoneal and the subdiaphragmatic plexus. And from these plexus, they can drain either into the liver, hepatic nodes, or they can reach up to the ovary. And whenever they reaches the hepatic nodes, they can cause obstruction called obstructive jaundice. And whenever they reaches the ovary, any carcinoma or cancer cells from the breast reaching the ovary can cause a secondary tumor there known by the name Krukenberg's tumor. Important. We mentioned about the superficial lymphatics. Complication apical part in the supraclavicular, infraclavicular, e side in the lateral aspect in the axillary nodes, e half in the parasternal nodes, some of the lymphatics are closing the midline also. From this lower quadrant is reaching up to the hepatic nodes and ovary by means of subdiaphragmatic or the subperitoneal plexus. So these are the importance of the superficial lymphatics. We can see metastasis happening of the breast pathologies either to the opposite breast or towards the liver, causing the obstructive jaundice, or reaches the opposite towards the ovary, causing a tumor called Krukenberg's tumor. So we mentioned about the lymph nodes, superficial lymphatics and deep lymphatics. Anatomy, last heading should be your clinical anatomy or the applied aspect. The main clinical anatomy is Carcinoma breast or the CA breast, one of the most common carcinomas in females. And In that you will be asked ഒരു ക്ലിനിക്കൽ ക്വസ്റ്റൻ ആയിട്ടൊക്കെ ചോദിക്കാം. ആൻഡ് 2-3 കാര്യങ്ങൾ നിങ്ങൾ ഇതിന്റെ സൂപ്പർഫിഷ്യൽ ലിംഫാറ്റിക്സിനോട് ചേർന്ന് അറിഞ്ഞിരിക്കണം. There is an appearance called purely orange appearance of the skin. Sometimes the skin can be involved in carcinoma breast will appear like a orange peel appearance. That particular appearance is called purely orange appearance. And you will be asked about what is the cause of this purely orange appearance. Mainly the cancer cell spread, and they will obstruct the superficial lymphatics. So whenever there is obstruction of the superficial lymphatics, lymph ഇവിടെ കെട്ടിക്കിടക്കില്ലേ, so it causes the edema of the skin. So it will give us a orange peel-like appearance with some dimples. So what is the cause of this purely orange appearance? It's because of the obstruction of the superficial lymphatics. And these are 2 other clinical symptom signs we can see in the case of carcinoma breast. There is retraction of the skin and the retraction of the nipple. Whenever there are suspensory ligament, whenever these cancer cells involve the suspensory ligaments, it can cause the retraction of the skin. Whenever the lactiferous ducts are involved, it can cause what? The retraction of nipple. It causes a question added. So this is all about the lymphatic drainage of the breast. You can expect this as a short essay or a short note question, and along with the sub question in the essay topic.